Hi, welcome to week 10. This week we're going to start 3 weeks related to the financing of healthcare. So these are fairly long units, but they're very important units because everything you do in this program, from coding to your reimbursement, is going to be influenced by these next few weeks. They're also my favorite chapters, so I can kind of get a little bit into this. These are the objectives. I'm not going to read these over. Just want to let you know there's a lot of slides in this one, so I'm going to be recording it in 3 parts. Okay, so when I leave off, part 2 will take over from there. And that way you don't have to listen to me for so long. What we're talking about today is the first thing about financing and how did financing become such a huge role in the United States health industry. So we're going to talk about the history of health insurance, the role of the government, and private pay versus government pay. In the late 1800s, early 20th century, just a history lesson, most care was provided in a patient's home, and the person either paid for their own care or there was charity care, but there wasn't any organized system. Well, as time went on, medicine began to advance and it became a science, especially in surgery and infectious disease. Now, mind you, we're still talking about the early 1900s. And the AMA standards for medical quality care started to improve. So in other words, what this is saying is that medical care has evolved and it went from home-based to more specialty care where you went somewhere for care instead of the physician coming to you. Commercial insurance was not available because of unpredictability of health and a moral hazard. What that means, they couldn't sell insurance. Nobody wanted to do insurance. They didn't have enough research on disease and things like that to even try to put a price on it. And a moral hazard, that's a term you're going to hear throughout the program and throughout your profession. A moral hazard just means if you have something, it creates an incentive to use it. So for example, if I have health insurance, that can create an incentive to use it when I don't need to use it. For example, I have health insurance that pays for emergency room care. If it pays for emergency room care, I may choose to do that instead of making a doctor's appointment because it may be more convenient. That's a moral hazard. Okay, it's like when you buy homeowners insurance and you have a $500 deductible, and if something happens, as long as it's over $500, you don't care because the deductible is only that much. So early physician hospitals and health plans did start to evolve. And the very first ones was in 1929 when the city of Dallas, their school teachers contracted with Baylor Hospital for 50 cents per month to provide services. The reason they did this is like any employer. It was difficult to find employees and they couldn't always afford extra pay, so this became a benefit from them. This early plan became the first Blue Cross Blue Shield. Then what happened? In 1939, California physicians formed prepaid healthcare services, and that became Blue Shield. So you got Blue Cross Blue Shield. So when you read your transcript for this, transcript part A, it'll explain that a little bit more. Then there was a group called Ross Los Medical Group. They had prepaid care to Los Angeles employees. That was believed to be the first HMO in the United States. And basically they wanted quality of care, including preventative care. Now this is all a long time ago. In the 1930s, there was also incentives to organize for prepaid plan for construction workers in Los Angeles. That later became Permanente Health Plan. Notice how it all started. None of this was started by the government. They were started by employers or medical groups as a way to provide care at a reasonable cost. But this is when the times changed. Social Security Act of 1935 was part of the New Deal under President Franklin Roosevelt. It was the first time they established a system of old age benefits for workers. In other words, they created Social Security. And you can see here what the Social Security Act did. Prior to that time, when you became elderly in the United States, if you didn't have a job or family, you didn't have any money, and people would go to poor farms or areas like that. There just wasn't anything to be taken care of. After that, then we got commercial health insurance. And during the 40s, this was during the 40s, carriers noted an increase in the growth of hospital and physician blue plans and began offering group health insurance on other plans. So conditions that provided for this movement was the need to enroll large groups of people. And by enrolling large groups of people, what happened then, you spread that risk of loss or insurance payment along a bigger group of people, and that reduced that moral hazard. So the larger the group, the lower the cost could be because you spread the risk out. If you're insuring one person and they get sick, it's a big risk. They also started doing what's called experience rating, an experience rating versus community rating. So on experience rating, what that means in insurance, they'll look at the group. So if you're in a group plan with a lot of younger, healthier individuals, you may get a lower rate than if you're in a community group that has a wide age group of individuals. Other factors that drove the development of health insurance, wage controls. Again, World War II, a lot of young men were in the service. They offered health insurance as a benefit to attract skilled workers during that time. The IRS, or the Internal Revenue System, started giving favorable tax treatment. So employer, they were free of a payroll tax, employee, no income tax on that health benefit. So for example, if you got a health plan worth $200 a month at that time, or whatever it would have been, you didn't pay income tax. It was counted as a benefit and not income. So it was a way to provide a better quality of life for their employees. Employer-sponsored health plans were non-cancelable. And then in 1949, that period of time, unions started to become very established in the United States, and unions started negotiating health insurance benefits as part wages. Now, Hill-Burton Act, this is something that you need to remember, and you might want to remember this for your final activity in one of your essay questions. The Hill-Burton Act was established in 1946, and the purpose was, again, as I told you earlier in this course, to stimulate construction of facilities. As I told you earlier, a lot of our hospitals wouldn't be here without Hill-Burton, but the government doesn't give anything away for free. As part of the condition under Hill-Burton, then a hospital that got that funding also agreed to provide a certain part of their services in free care. It also required participation in Medicare and Medicaid at a later time. Now, in 1946, there was no Medicare and there was no Medicaid, so these were amendments to it. But at that time, Hill-Burton said, you have to do so much charitable care per year because you're going to have poor coming in who don't have the ability to pay. So then here's the big one, Medicare and Medicaid laws, 1965. Okay, it was part of Lyndon B. Johnson's Great Society. Medicare is called Title 18, and what Medicare is social insurance for the elderly. It's health care for the elderly. You pay to Medicare, we all do, through our FICA taxes that come out of our paycheck. Medicaid is called Title 19 as an amendment to the Social Security Act. That is a social welfare program, and that's funded now by federal tax and state tax. Medicaid, unlike Medicare, is administered through the states. Medicare is funded by the government. Medicaid is funded by tax revenues. So, the reason why Medicare and Medicaid were so important, we'll get this into a later unit, is because the government became a payer of health care services, and it's been a roller coaster ever since. Another big funding thing then happened in 1973. That was your Health Maintenance Organization Act. That was when the government started encouraging the development of HMOs. So they could require employers to offer traditional health plans, also an HMO option. The difference between HMO and a health plan, an HMO offers comprehensive prepaid health coverage for hospitals and doctor services as long as you go through a specific health care provider. These prepaid health plans then gave the employer access to the market so they could shop around and get the best rates. So basically an HMO, employer, one fee was paid in and these were the services that you got and it covered their members. The reason why HMOs developed is because it was a cost containment answer to Medicare. Another thing that happened then was the Employee Retirement Income Security Act of 1974, or ERISA. What that did, it regulated employers' self-insured health plans. It didn't require employer to be self-insured. It just says if you do it, we're going to regulate it. So if you have an employer self-insured health plan, you have to meet minimum standards. You have to have plan administrators, you have to have a grievance and appeal process, and employees can sue for benefits. They preempt state laws. So for example, where I work, we are a self-insured health plan. And basically, you don't see any difference in any other health plan. On that, it's just that the funding of the payment is different. Health plans today, 83% of the population have health care insurance. Now this number may be different. If you look it up on the internet, you could see something else, because with ARA, more and more people became insured. But there's two categories of health plans. There's privately funded, so you get your insurance through a state licensed insurance organization, like, the state of Iowa has Blue Cross Blue Shield. They have Farm Bureau insurance, just different kinds. You can also get federal regulated self-insured employer plans. And then you have publicly funded plans. Your state licensed insurance are your commercial health carriers. They're owned by stockholders or stock companies. Mutual insurance are owned by their policy holders. Blue Cross Blue Shield is the most common. There's 39 different companies in 50 states nationwide. Locally operated, some Blue Cross Blue Shield are for-profit, but Blue Cross Blue Shield covers now 1 in 3 Americans. You have managed care organizations, which we talked about. A managed care organization is an HMO. The 3 types: HMOs, PPOs, point-of-service plans. You'll see what their categories, what they do, but their main focus is cost control and utilization. They want to change their policy holders' behaviors to get the best care, the right care, in the right place. Self-funded plans, health benefit plans that are regulated by federal law. Again, I mentioned that. In a self-funded plan, your employer assumes the risk for workers and they pay the care directly. So if you are self-funded and you have a bad year, let's say you have 5 employees who have high-cost cancer treatments or major trauma, that is really a risk that that employer assumes because they're paying the cost of that. Publicly funded health care, government programs, some of them are funded through payroll tax, like Medicare, began in federal legislation. Medicare and Medicaid was federal legislation, was voted into law by Congress in 1965. They only help certain populations. They do not help everybody. And they're run by the federal government and the federal state partnerships. That's a repeat from an earlier slide. So government health plans, besides Medicare and Medicaid, you have CHIP, the Veterans Health Administration, TRICARE, which is health care for our armed services, and the Indian Health Service. So the role of the government is 3 key roles: provider, payer, and lawmaker. They provide services for the veterans and TRICARE, Indian Health, and then they support research through organizations like the AHRQ. They're a payer of third-party services, so they can outsource healthcare services, claims paperwork, and grants for research. So I'm going to stop here. We're almost at 15 minutes, and we're going to pick up with the roles of the government. It's very important in these units that you read your transcripts because it's going to help you with your final essay questions at the end of this course. So I'll talk to you in just a little bit.